Alrighty, good evening, everyone. I am Lauren Gates, your host of this evening's Airway Health Solutions conversation series with world-renowned speech pathologist and author of Sleep Direct Kids, Sharon Moore. Our topic tonight is Pediatric Sleep is Everybody's Business, which is a perfect theme to celebrate February National Children's Oral Health Month. So welcome, Sharon. We are so thrilled and so appreciative of you taking the time to help us raise pediatric airway health and sleep awareness. So all the way from Australia. Good evening or good afternoon. Good day.
Well, yeah, good day. It's 12 midday here the next day. So you're Wednesday evening, we're already Thursday.
Wow, so you're a whole day ahead, but we are so thrilled to offer this event with free CE and recordings as part of our Airway Health Solutions Airway Health movement. But let's see who's with us tonight. We always like to get a kind of a feel of our audience. So we're going to go ahead and take a poll. Let's launch that and find out who we have with us this evening. We had over 300 registered. A lot of people are going to watch this later, but let me see if the poll is launching. I don't see a poll launching. There we go. So if you can, let's just get to know you and tell us what profession you are. That would be wonderful. Give it a minute. 81% participation. So dental hygienists are in the lead this evening, followed by dentists. And I'm sorry, we don't have a description for each profession. So I apologize for that, but let's go ahead and see and share our results. There we go. Okay, well, welcome everybody. We're thrilled to have you this evening. And I'm just going to do a few disclaimers. I know it's a little boring, but we have to do this. So the views presented are the opinions of our speaker and are not necessarily affiliated with Lauren Gates and Associates and Airway Health Solutions. The following webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. The information provided should not be used for diagnosing or treating a health problem or disease, and those seeking personal medical advice should consult with a licensed physician or dentist. Always seek the advice of your doctor or other qualified health provider regarding a medical or dental condition. And then just some housekeeping items. We do offer free CE for this evening, but you need to be present for the full hour. The Zoom software does track your attendance, so you do not need a code or a survey. And at the end of our presentation, we're going to hold a live raffle where this evening, one lucky attendee will win a live ticket to attend Airway Palooza in New Orleans at the Ritz-Carlton. And if you can't attend live, then we will give you the on-demand version, which is March 15th and 16th. The winner must be present to win. So we got that behind us. Sharon, I would love to just give you a formal introduction for those of us, those who don't know you yet. They're in for a treat tonight. Sharon Moore is author of Sleep Direct Kids and the founder of Well Spoken, a speech pathology and oral facial myofunctional clinic in Canberra, Australia. Sharon has 4 decades of clinical experience across a range of communication and swallowing disorders. She has worked in diverse clinical settings in Australia and London. Currently, Sharon runs a private practice for patients of all ages and is part of the transdisciplinary team for is it Canberra? Am I saying that properly? Or
Canberra.
Canberra, thank you. I knew you sound so much nicer than the Long Island accent version. Can you just say Canberra? It sounds so lovely. The Canberra Sleep Clinic. The integration of oral facial myofunctional principles and traditional speech pathology work allows a unique approach to managing disorders of the upper airway, including breathing and swallowing, chewing, phonation, resonance, speech, and sleep issues related to upper airway obstruction. Sharon has a special interest in the early identification of craniofacial growth anomalies in syndromic and non-syndromic children and concomitant oral facial dysfunctions and airway obstruction in sleep disorders. You know, Sharon, a lot of these are saying what you believe. I'm just going to, rather than read it, why don't I just ask you here how you got involved in all this and, you know, where your passion lies, and tell us a little bit about the overview of your career thus far.
Oh, there were quite a few things in there. Let's start with, well, how did I get interested in sleep?
Yeah, how did you, you know, you've been doing this for 40 years. You started somewhere. How did you know that this was your calling, or did you just kind of fall into it? What's your trajectory from your career?
Yeah, I think, you know, a series of light bulb moments, I think, is probably the best way to describe it. And I think it started with some of the sleep research that started coming out. And then I started wondering, how could I ever make progress with kids in clinic when they were literally sleep wrecked? Because it impacts their learning, their memory, their behavior, and all of the things that are required for kids to succeed in therapy were being undermined by this pillar of health. And so I thought, well, if we don't get sleep right, then how do we get kids to, get better? So there was that. And then the research from Brazil came out highlighting the importance of, let's call it upper airway fitness or upper airway patency, and the role of upper airway patency in sleep. And of course, that is central to the work that we do, that some speech pathologists do, particularly the medically based speech pathologists. We work with the upper airway. And we work with things that go wrong. And this was like another light bulb. Oh my gosh, at night, things go wrong in the airway, and they're just as important as in the day. So I got really excited about that. And then the rest is kind of history. People like Dr. Christian Guilleminault, I mean, I am one of thousands of people that are literally carrying his mantle. He inspired everybody he touched, and I'm one of them, So I guess that is why. And then I just, I knew I couldn't rest until I wrote the book.
Wonderful. Well, thank you so much for doing that. In fact, my daughter now is at the age of some of her friends are having baby showers, and that's a must-have in the basket. So that's always a great suggestion. What a better gift as a young mom to really have your eyes opened wide at an early stage. So thank you for that amazing contribution. And we have a nice program in store for us this evening. I'm going to go ahead and give you the reins to go ahead and share your screen, and let's take about, however long you need, 30 to 35 minutes or so. And then we'll have lots of questions after. I have a lot of interest tonight. So we welcome, and take it away.
Okay, let's see. Here we go. Can you see that?
Yep, it's all good.
Awesome.
Thank you.
Okay, so pediatric sleep, it really is everybody's business. And so hello, everybody. Thank you so much for being here. And thank you, Lauren and the Airway Health Solutions, for an opportunity to share my work. Today, I'm basing this presentation actually and pivoting it from our usual discussions on pediatric sleep, because I want to talk about it as a public health challenge. It's zooming out, if you like. It's taking a look at pediatric sleep from a broader perspective and thinking about how we as health professionals may be able to shift the needle for pediatric sleep and, of course, sleep disordered breathing via public health messaging and models. And that means embracing sleep as a public health issue. And that's what I spoke about at World Sleep in Brazil in October last year. Our symposium team was Dr. David Gozal, Dr. Jeevan Jahendran, Dr. Esther Bianchini, and our orthodontist, Dr. Almiro Mercado. Unfortunately, he had COVID and couldn't be there, but it was a fantastic team, and I think a fantastic symposium, and I'm very proud to have been able to present. And so this is a version of that. Public health messaging is really about delivering messages to the public. And so we are cruising through tonight the global call for better recognition of pediatric sleep challenges, public health and transformational medicine. And the Australian government has been doing something phenomenal in this area. So I'll tell you a bit about that. I will, throughout the presentation, talk about the importance of early intervention, which is no news to anyone really, and also share a decision-making roadmap which I use in my clinic. We're not going to do death by research today. but I will share some key points from some papers that refer to the critical importance of good sleep in a child's earliest years of development. And so if we look broadly at sleep health and where it sits alongside the other pillars of health, nutrition, exercise, and stress management, all of them, of course, are really important. They promote and support every domain of a child's development. But sleep is arguably the pillar of the other pillars of health. It is a biological necessity. And pediatric sleep problems aren't just localized to impacts on the family and daily life or the developmental issues. They really spill over into the public domain, into public health and education and social issues. And when talking about public health and effective public health messaging, stories are one of multiple effective strategies. And in this vein, I'm going to share a short story that came from the book Upstream that was originally recommended to me some years ago by Dr. Susan Maples. Thank you. I don't know if you're on the call, but thank you. And the story goes like this. There are two friends on a riverside picnic. They found children drowning, so they raced in, they rescued the children, but no sooner were they back to shore than they noticed there was another child and then another and another. There were simply too many to save them all. So they took a walk upstream to find out why all these children were drowning. So identifying and finding the cause is upstream intervention. Of course, our health systems are designed and primed for downstream interventions, and we're pretty good at them. This story, I think, is particularly relevant to pediatric sleep disorder breathing and its relationship to the development of adult sleep disorder breathing, the pathogenesis, if you like. And the question is, will upstream interventions shift the needle? And when thinking about kids' sleep as a public health issue, we say public health policies that include sleep health initiatives and advanced public health agendas, they are essential to the UN Sustainable Development Goal number 3, because they will ensure healthy lives and promote well-being for all ages. And of course, sleep problems impact across society, but there's a huge fiscal cost to that of untreated sleep problems. And the GDP estimated to governments is 1.6 to 2.5%. And sleep disorder breathing, of course, is a big contributor to that burden. On the contrary, with good sleep, it is estimated that it would halve the cost of health and double the funds available in education resources. And there's no shortage of support for proactive advocacy in pediatric sleep health. The World Sleep Society Task Force in October 2023 published in The Lancet, and they're calling out for a great need to promote sleep health, promote those public health agendas across the globe. And they highlighted in relation to children that children are vulnerable to sleep deficiency that leads to behavioural problems. This is so well backed up in research that we all know well, like the Bonnock study and many others. Children's sleep deficiency has been associated with sleep deficiencies in adults. This is talking to the evolutionary nature of untreated sleep problems. It doesn't necessarily resolve. It doesn't necessarily go away. Lower social class is predictive of shorter sleep duration in children. This just magnifies their disadvantage. We must address this. And of course, sleep disorder breathing contributes to these burdens. So kids' sleep is a big problem, but we know there are recognizable signs and symptoms, and they're measurable. And despite the prevalence of sleep problems broadly, you know, sleep health issues are really not fully regarded or acknowledged in most health communities. So what is public health, and what is the role of public health? It's the science of protecting and improving the health of communities through education, through policy making, through research and prevention of disease. Public health policies have the power to bring change. And it's the translational science, in fact, that informs that public health messaging. It takes the science and the clinical data and it delivers directly into communities' fingertips. And with children, I'm going to say, rather than call it prevention, let's call it early intervention. I won't go into all the details. I've got some very good reasons for suggesting that, but we do need to see it as soon as it starts. And I don't think we're convincing anyone here on that call. Public health messaging in pediatric sleep disorder breathing has to be directed at parents and professionals and in health and education around early intervention and management. And it matters because support at the public health policy level brings in the funding and it has the power to bring changes in health. So why is kids' sleep health such a big deal? Lots of reasons, but if we focus just on brain development, this study in June 2020, it shows and talks about how the early years of life are characterized by these dramatic developmental changes and how sleep plays such a key role in the healthy cognitive and psychosocial development in those early years. We know the impact of sleep on early brain development. We know that it matters. Sleep and early brain development are inseparable. And the research is showing us that sleep problems impact cortical maturation, focusing at the prefrontal cortex level that governs executive brain functions. And irrespective of the cause and irrespective of the severity of a sleep problem, it will impact brain maturation, 90% of which is complete by age 5. And if we look at the prevalence of sleep problems and sleep disorder breathing, we know up to 40% of 4 to 10-year-olds have sleep problems, and that is thought to be a conservative figure. 1 to 5% have obstructive sleep apnea, although I also see the statistic 3 to 6%. I don't know which one's right, but they're about the same. We also know that more than 80% of kids with sleep issues are just not being recognised or treated, misdiagnosed, even dismissed. Up to 27% of kids snore, and that is not just about obstructive sleep apnea. We do know that. The data on mouth breathing prevalence, which also impacts sleep, is 10 to 57%. And this new paper that came out last year on comorbid insomnia and obstructive sleep apnea is really interesting. It was published, I think, in September by a Portuguese group, also authored by Dr. David Gozal. And so if we consider that statement from the Lancet, where we say children's sleep deficiency has been associated with sleep deficiency in adulthood, and we just look at sleep disorder breathing, given the pertinence of that to our clinical work, well, we know that there's a range of ventilatory disorders that disrupt sleep, but we say, when does it start? Because we know it's a group of sleep condition that causes reduction of upper airway airflow, and there's obstructive sleep apnea, there's snoring, there's upper airway resistance syndrome, or we know that terminology is debatable, respiratory effort-related arousals, and mouth breathing. But I'm going to quote from Dr. Dave McCarthy, is that obstructive sleep apnea in adulthood is an end stage of a long process that involves chronic airflow limitation. We need to identify the risk factors early, especially with kids. So there is that evolutionary component, but we can also say anything that leads to sleep fragmentation interrupts the integrity of sleep. And with regard to sleep disorder breathing, but anything that leads to disrupted airflow during sleep can lead to sleep fragmentation, and that is a problem. This white paper that was released in July last year underscores again, the importance of pediatric sleep and public health policy. One section in there, which I'm going to highlight, provided an overview of pediatric sleep disorder breathing, supporting the need for early diagnosis and treatment of obstructive sleep apnea, saying they're critical because we know about the short and long-term implications. But they really only talked about obstructive sleep apnea. And they said, we've got to identify those risks, those known risks. We need to treat precisely. And they said there's not enough evidence for rapid maxillary expansion. And what I'd like to say, because of the probably the people that we have on the group today, is how can we go about pooling the data from the dentists that are currently offering early intervention growth guidance? Because there must be so much data out there that could contribute a very different story to this discussion. So, food for thought. But when we look at this paper, for example, for guidance, where do we go from here? This was Ghazal and Ghazal, March 2020. The paper is Treatment of Obstructive Sleep Apnea in Children, Handling the Unknown with Precision. How does it inform us? How does it help us know what are the critical messages that we are confident to share and act on in a clinical context? Well, we know we need more research, but we can answer a lot of things with a fair confidence. We know kids need access to treatment. We know it needs to be precisely designed, complementary, and multidisciplinary. We can say that with real confidence. If we do focus on pediatric obstructive sleep apnea, this paper in Feb 2021, Phenotypic Variants in Pediatric Obstructive Sleep Apnea, it labours the point of multi-dimensional assessment strategy so that the unique anatomical and functional abnormalities that predispose the upper airway to obstruction can be identified easily and accurately in two groups, in otherwise healthy children and in children with complex condition. It's a good paper if you haven't seen it. And again, from that same paper, Ghazal and Ghazal, you know, what are the critical messages that we're confident to share and act on in a clinical context? Better access to testing and care, multidisciplinary intervention. It must be precise. We need to know what is the craniofacial structural insufficiency. And in that paper, Ghazal, he mentions that rapid maxillary expansion is an interventional option. He also talks about removing lymph tissues and managing inflammatory conditions. I call that dealing with issues with the tissues. He also mentions airway muscle dysfunctions, which is in the myofunctional, speech language pathology, physio, OT realm. And he also mentions the need for other medical interventions like CPAP. But it is always a case-by-case basis, depending on symptoms and symptom severity. This paper by Unit al, it describes those pivotal moments along the development of the craniofacial structure that are modifiable, and that normalizing airway functions at every step of that developmental pathway has a key role to play, including with preschoolers. You know, growth patterns can be intercepted. So with those things in mind, you know, what is the public health messaging to caregivers and parents? What are the critical messages that we are confident to share and act on in caregiver guidance? Well, we know sleep matters. That's important. But we also need to know, well, what kind of sleep problem is it? And if there is a sleep problem, what is actually causing it? Does it happen to be sleep disorder breathing? Not everything is airway related. And of course, those answers are going to look very different depending on whether those children are otherwise healthy or with complex medical conditions. And it's certainly not all doom and gloom. You might want to check out this article that's coming out in Dental Sleep Practice, where I update the research from the initial publication of sleep-wrecked kids. And here I want to share a model that I've been using in my clinic for many, many years. I call it the kid sleep puzzle because kid sleep health is literally like a puzzle. And I still use this model in my head and on paper in my clinic to this day. It always starts with screening and assessment. That's in the top orange bubble, because that guides my decision making as, you know, where we need to go next. And I'm going to share my screening protocols in detail at Airway Palooza in March, along with the myofunctional and upper airway treatment planning that I use in my clinic to address sleep disorder breathing in preschoolers. Suffice to say, along with messaging to parents, the messages usually need to be accompanied by visual resources, and this is one of mine. This is a poster I developed called Breathe Well, Little One, Sleep Well, and Thrive, which is part of my Sleep Fit for Life modules for parents that will be launching very soon. The poster is based on the sleep questionnaire that I developed with Dr. Jim Papadopoulos, a pediatric sleep specialist, about 10 years ago. This screener is designed to capture a range of sleep challenges at sleep onset, during sleep, on waking, and during the day. It allows ongoing monitoring of symptoms of concern. There's triage sections. It provides, in my experience, a fantastic opportunity to educate and launch a conversation with parents about sleep. And, you know, it's simple in that any yes response literally is a reason to prompt more and talk more. And so the poster corresponds directly with my screening form and allows us to explore all those different areas that I just mentioned. And I'm happy to notice that this approach is totally congruent with Dr. Dave McCarty's 5 Reasons to Treat. And I love Dr. McCarty's approach because it is so patient-centered and so patient-friendly, which is exactly what they need. And screening is critical to help answer parents' questions or start that conversation. So many parents in my clinic over the years, firstly, they're unaware of sleep being as important as it is. And that screening tool that I've just mentioned helps to tease out what may be going on and guide parents to the next step and help me to understand what other members of the team may be needed. We need to be able to answer parents' questions in parent-friendly language. Well, does my child have a sleep problem? I thought their sleep was fine. Well, how do I know? Well, how could I tell? Okay, now once they know, they want to do everything yesterday. What can I do myself at home? Well, what's causing it? How do I fix it? Do I need expert help? What can I do by myself? If I need expert help, where, who, how? Is there a cure? How long will it take? Are we, you know, will this ever go away? So this form has been informative and I use it every day. And it is really great awareness screening tool. And you can see here how I just use highlighting in the clinical process to show me where there are areas of need. And so screening unravels parents' beliefs about sleep and can then follow with a very gentle and systematic dispelling of those myths. So we're not trying to scare or intimidate people, because that would be very easy to do if we throw all the statistics out there. It's a gentle process, but I have to say that to this day, I still hear parents saying, oh, look, I can train myself to need less sleep. I can train my kids to need less sleep. They only snore a bit. It doesn't matter, etc. So we do have work to do. Parents' questions. How do I know if my child's sleep is okay? Well, they need to learn what to look for, what to listen for. You know, is my child's breathing okay? What can I see? What can I hear? And this is where tools like SnoreLab I have found very useful as well, alongside videos and photos that parents provide. So we have clues, we have indicators in the night. And we also have indicators about what happens in the day, behavior, mood, emotional regulation issues, inopportune naps. No matter the type or severity of sleep problems, it can lead to these. We know ADHD is an issue. And so parents need to be reassured that sleep challenges are treatable. The earlier, the better. But to do that, we need to know what the problem is. And that is what I call a forensic exercise. It is certainly that way in my clinic. And I find myself assisting parents to navigate often the medical and the dental systems that are available. And my clinical skills are not always needed. They want to know, do I need professional expertise? Who? Because there are so many to choose from. ENT, gastroenterology, neurology, allergy specialists, respiratory specialists, the list goes on and on. And of course, screening helps us to know if the child simply has what I call out of order sleep. It's just to do with environment and behavior and routines. And there's an awful lot that parents can do at home to really modify those things and make a huge difference in a very short time, versus whether they have an actual sleep disorder, which really must require medical specialist expertise. And there are over 80 sleep disorders, and those that might find in children in particular insomnia and airway related sleep disorders, but those others as well possibly, but they need medical specialist expertise. And when it comes to the role of the dentist or the orthodontist, recognizing craniofacial growth patterns is important. And I ask the question, can we really ignore the signs of deficient craniofacial growth that impact breathing? I mean, this paper truly says they don't grow out of it. And if we think about sleep disorder breathing with obstructive sleep apnea alone, this developing burden of chronic disease globally, and there is not one health system globally equipped to deal with the avalanche of chronic disease in aging populations. It's coming, and it's associated with untreated sleep problems and sleep disorder breathing, obstructive sleep apnea in particular. So, launching a sleep health awareness inquiry was a stroke of brilliance for Australian health going into the future. And the Australasian Sleep Association and Sleep Health Foundation in Australia worked relentlessly to bring the science of sleep directly to federal government in Australia. I like to describe it as the modern day storming of the Bastille, the non-violent one, aiming to revolutionise sleep health in Australia. They called it the Big Bang, and it resulted in a national sleep health awareness inquiry across Australia. And that was intense lobbying required to get to that point, but there were 138 submissions. 3 were mine. There were 30 exhibits. 1 was mine, flying that flag for kids and allied health. There were 4 public hearings around the country in January, February 2019 across 4 of the major cities in Australia. I was at the hearing in Canberra, again, flying the flag for kids and allied health. It was a leave no stone unturned process that resulted in the publication of bedtime reading. A large document with 11 recommendations, and going forward were to be implemented by the Federal Department of Health and rolled out across Australia. A lot happened since 2019. COVID was one of them. And so we waited for 4.5 years. But in September 2023, the government commitment in writing from the Department of Health said they were to include sleep as a pillar of health alongside exercise and nutrition. Yay. And the first step was to launch a sleep awareness campaign as part of the existing broader health strategies already in place that were already happening. I am reassured by them that initiatives for children's sleep are weaved all the way through these proposed initiatives. There's a lot we could learn from this government inquiry. First of all, it takes a lot of work by a lot of people, but it demonstrated that government to government level inquiry and response was really required to shift the dial on sleep health of a nation and secure the funding. In fact, the CEO of the Sleep Health Foundation says, don't give up, keep lobbying. The way to get traction is by getting the government invested. This could be a model for other countries to follow. You know, in all that time we were waiting, I was thinking, this is a long time while we wait for the wheels of government to turn. Do we wait? What else can we do? Well, there's an awful lot that we can do. You know, we know that public health campaigns work. And this time around with the sleep, there's no funding for a full-on campaign. But there are many ways to deliver effective messaging to the community through advocacy groups. And we in the clinical domains have a very important role to play. We can learn from marketing strategies, storytelling, high impact visuals, simple, consistent messages, memorable slogans, sometimes scare tactics, but not too much. Short action statements. Slip, slop, slap. That was the anti-skin cancer campaign. I can quit. That was the anti-smoking campaign. Prevention is the only cure. That was the AIDS campaign. And life be in it. That was the get off the couch and move your body campaign. What is already happening out in the field with regard to pediatric sleep and sleep disorder breathing? You know, we can all do this in our clinical practices, in our communities, in our families, in our societies. Messages from the field, the clinical frontline that translate the science that we know so well into the public domain. Well, here's some examples. The pajama program. Good nights are good days. By investing in bedtime, we invest in children's futures. Here's a story that was told by our wonderful pediatric sleep specialist, Dr. Judy Owens, who's a trailblazer for pediatric kids' sleep health. She said, half of all my kids have some symptoms of sleep disordered breathing. Find a sleep expert. And I have to say that the dentists and the dental communities are the shakers and the movers. Here we have ASAP Pathway, because kids can't wait. We have Dr. Susan Maples, See It Sooner. We have the American Academy of Craniofacial Pain, the Australia group, Breathe, Sleep, Grow. We have Children's Airway First Foundation, Fix Before 6. Breathe, Eat, Sleep, Thrive. That was a term developed in the Endeavour Forum of the AAPMD over a number of our many meetings in about 3.5 years over COVID. It's great, simple messaging. And I think that was partly the brainchild of Dr. Steve Carstensen. So I like to give credit there. But it really laser points to the key functional features that support craniofacial growth and good breathing. So I added Airway Best by 5 because it rhymes, Breathe, Eat, Sleep, Thrive, Airway Best by 5, for clinical use on the Parents platform that I will be launching very soon. See it as soon as it starts. That's my clinical motto. That was inspired by See It Sooner by Dr. Susan Maples. And this paper about mouth breathing has a key phrase: watchful waiting is not enough. It's powerful. Treat issues with the tissues. That's the one I use in my clinic to help patients understand why they might need ENT intervention. For some kids, the instructions are as simple as keeping the nose clear. Blow your nose. Use Flow. Now, Flow is an Australian saline rinsing product, which is fantastic. I recommend it highly. Kids can do it. And these are things that parents remember, these very short, easy phrases. Improve airway fitness and function. It's Airway Fit. Again, my new parent modules coming online, Airway Fit for Life. And there as well, there's a huge potential role for sleep screening across allied health communities yet to be explored. In this paper, if you haven't seen it, read it. I think it's presented beautifully. Professor Karen Bonnack, she talks about sleep problem screening of young children by speech language pathologists, but I see no reason why that should not be rolled out across allied health. We are in a fantastic frontline position with young kids to recognise these issues. So pediatric sleep is everybody's business, especially when it comes to kids. We know there's polarised thinking in medical, dental and allied health communities about in whose domain does sleep belong. Well, sleep is everyone's business: health, education, early childhood, parents and children. In closing, addressing sleep in early childhood literally is the poster child for upstream intervention. When we catch children upstream, our kids get the sleep they need every single night to be healthy and happy. And we all have a role to play. Thank you very much for tuning in.
Wow, there is so much amazing information here, and I am so thrilled that this is recorded and free for everyone to access. If you registered, we'll send you the recording, and then it is later accessed on our YouTube channel. What a great 40 solid packed minutes of information that my mind is like exploding. I think it's everybody's business to maybe come up with some catchphrases. You know, we have how many people on this call? 110 right now. And I know we're all pretty smart and we have, you know, we can come up with some clever things. So I'm actually interested in maybe starting a contest of some kind. That sounds like a lot of fun, to come up with the catchiest slogans and we can all share them, because the ones that you came up with are spectacular. It almost reminds me of jingles, if you would, to music, right? They
Totally.
you know, so I know Dave McCarty is actually on here. I'm going to go ahead and actually bring him on as a panelist, because I know he can add to this conversation. There are so many things I wanted to discuss, but there are also some questions too. So let me just see. He'll be joining. Dr. McCarty will be joining as well. I know you made reference to him a couple of times, but while a couple of questions here, can you expand on sleep disordered breathing and bedwetting, Sharon?
Well, nocturia is a common problem when there's sleep disorder breathing. So that's a pretty easy one, actually. A lot of kids that have disrupted sleep. Let me just get rid of something here for a second on my screen.
Yeah, and while you're
in the sleep phases, when does bedwetting happen? Usually stage 3, actually. Well, that's the information that I have, that it's more likely to. Oh, hello.
Hello.
Hi, Dr. McCarty, welcome.
I just figured out that my video was not on, so I've rectified that.
There we go. Welcome.
Thank you. It's nice to be here.
Yeah.
Sharon, wonderful job. Thank you for a marvelous presentation.
Thank you. It's a pleasure.
Yeah.
Passion topic.
What I loved, what we were discussing, is that it's really our opportunity and obligation to take the science and the clinical data. The power to bring it to the community is through the data. And I loved how you're calling on the dentist to pull from this data, and maybe we could all come together. I just wanted to share with you, we are having a meeting just to do that on February 12th. With Dr. Kevin Boyd and Dr. Bill Arnold, Dr. Richard Baxter. We're trying to start this process. You have to start somewhere. So I keep hearing this theme over and over. And actually, Dr. McCarty, your voice is in my head: publish, publish, publish. So I think that's really the call to action, and what a wonderful job Australia has done in getting the science to the community. So I don't know, I'm up for the challenge too. I hope other people are, that we can really take this to the next level. There are some questions here. As an SL of sleep disordered breathing and OSA with oral facial myofunctional therapy should be within the scope of practice for SLPs.
Is the question, is it in the scope of practice?
Do you think it should be treatment of sleep disordered breathing and obstructive sleep apnea with oral facial myofunctional therapy should be within the scope of practice for SLPs?
Well, it certainly is in Brazil. And the Brazilians have a special training protocol. They study for 2 years. They're all PhDs. And in fact, I didn't include it in this presentation, but they have a brand new consensus that outlines all of the components that would be required for a speech language pathologist to be competent in, to be looking at sleep disorder breathing. We have enough science, you know, to use myofunctional therapy as an adjunctive treatment. Right? I think any speech pathologist who has proper training is in a position to offer it as an adjunctive treatment. But I mean, I don't know what the state licensure and the rules are in the various states.
Right.
Excuse me. In the United States, I know you've got 50 states and they are all governed by different rules. So I think that's probably more of a question for your local councils and.
Yeah, and it goes by state, but I think it was just more of an opinion of it if it should be by an SL.
Look, I just think that if you've got the skills, it's a component of managing sleep disorder breathing that is very valuable. But it needs to. It's not a sit-alone treatment. It needs to. It needs to be properly assessed within a multidisciplinary framework to see whether or not there is a functional element, or, you know, that can be improved by myofunctional therapy. And then you would do a trial and see if it's working. If it's not working, then you would stop doing it. Like, we don't do this kind of therapy ad infinitum. That is not what it's for. That is not what it's about. That's my opinion.
Thank you. Because I have Dr. McCarty on here too, there are a lot of questions about sleep tests and AHI. So when will sleep doctors stop using AHI as such a significant tracker? You guys want to?
Well, you know, I think that this is the question is what to do with this metric, you know, and once we recognize that the AHI is a metric that just needs to be unpacked, then we can sort of move beyond whether it's good or bad. You know, because there are things we've learned from the 4% AHI that are very valuable, that this is a deadly disease, and that's important information, but it's not all about that number. So I think that the teaching point that I've learned from this journey is that if we start using this term, it's not whether it's good or bad, it's how do we unpack this to the benefit of our patients? You know, that's a complex subject.
And Sharon, what is your feelings on sleep tests for children? There's a specific question on the watch pat for kids. How do you go about testing, sleep testing?
Well, in my clinic, I'm screening for sleep problems. And if I think that, you know, more in-depth screening is warranted, if that shows up, I will get the kids in my care to a pediatric sleep specialist, and or an ENT, or a dentist, or an orthodontist. I mean, I don't make decisions about whether polysomnography is used or not. I think there's an awful lot that we can tell about kids' breathing without PSG, but I really believe we need objective measures. And that's why I was pretty excited to see what David Gazal's research is coming up with, the biomarkers and other ways, easier ways. You know, home sleep testing, if that were a really reliable option, I think, you know, to be rolled out with kids would certainly be easier on families if it was going to produce the data that was required to make clinical decisions.
And then there's a question here about treatment using Munchie and exercises. What is your easy treatment? I don't know if that's ever an easy answer.
I don't think there's any such thing as an easy treatment. Honestly, I think, you know, it's like I said in the presentation, every child, it's a case-by-case basis. And there's two different ways of looking at airway health. We can look at airway health in terms of just fitness, is helping the system to become as fit as possible, versus we have a diagnosed dysfunction that we need to design a treatment program for that is tailored to that child. Now, in terms of a generalized upper airway fitness tool, a Munchie might be a useful tool, but so would Replenish swallowing bottles, which are fantastic, by the way. I've been trialing those. And, you know, I mean, learning to chew foods, like proper food, as close to nature, that's what I call it. So my aim in the clinic is to get kids eating chewy, with 70% of their diet, chewy, crunchy food too, because we know that chewing is a very critical feature of developing the craniofacial complex, but also maintaining muscle patency in the system and training the eustachian tubes and all sorts of other functions.
How do you manage a pediatrician who is, quote, too busy to bother with airway and sleep? What approach do you take for that effective communication?
Oh, that's quite a tricky one. Yeah, I mean, if they're too busy, they're probably too busy to have a chat and a cup of coffee.
Right.
Yeah. I mean, in the same way as we like to have a conversation with parents about what's going on with their kids. And, you know, this is what I love about Dr. McCarty's work, is he, you know, he talks about these non-threatening, non-intimidating conversations. That is how it has to be. But that's how our conversations with our other medical providers need to be set up as well, you know, in the same way. And I guess if it's too hard to do that, I would just be gently sending over some articles every so often, you know, what do you think about this?
Yes, I would actually send them the book, right? Send them just have a mysterious delivery. And
I didn't think of that. Oh, okay, yeah, I'll do that.
And yes, does Dr. McCarty have a book? He absolutely does. He has a beautiful blue book, Empowered Sleep Apnea, and we will
It's around here somewhere, but you know.
We're going to put that in the chat, as well as in your follow-up email, so you have access to that. And I'm just trying to get so I'm not looking this way, my screen this way. Just bear with me a second. You guys can see my screen, right? As far as
yes.
Okay, I'm just gonna like pivot a little bit here, because there we go. Okay, so I just wanted to give some follow-up information to what's coming up. And as Sharon said, she's going to have a wonderful presentation. Actually, Dr. McCarty will be there as well. But Sharon, I know you gave us a little teaser about what you're speaking about. You want to just go in a little bit more detail for the Palooza. We're thrilled to have you come all the way on the other side of the world. Come see us.
Oh, we always love to go to the Northern Hemisphere. Okay, so the title of my presentation is From Sleep Wreck to Well Slept in 3 Steps. And it really is just taking you through the model that I use, you know, starting with the screening, and then, you know, how we take parents and help them understand what it is that they can do at home, because they want stuff to do and they want it to do now. And then the other part of that decision making is, well, you know, who do I need to see in the medical, dental, allied health world, and how do we unpack all of that? And then what I'm going to do from there is then segue into what I do in my clinic with myofunctional strategies and correcting upper airway dysfunctions. And I'm going to share some of the strategies of the way that I work with little kids, because there's a special way of talking to little kids. It's all in the language. And we often have to teach parents how to talk to their kids because they often don't really know. And so we sometimes giving them phraseologies and formulas that really help them at home, because without parents doing stuff at home, nothing changes. Nothing. So
Absolutely. Well, I can't wait for that. It's going to be such a great lineup. The 15th is we're going to be focusing on pediatric health, and the 16th more so on adult health. Dr. McCarty, while I have you here, you want to go ahead and share what you're going to be contributing to the Palooza? We're thrilled to have you.
Yes, I'm very excited. Basically, my teaching points about sleep apnea are that this is a very complex problem. And as complexity goes, that means that the problem must be approached in a way that we probe about it and ask questions about it as we go. And the unpacking of this complexity happens differently in different silos of thought. And what that does not prepare the patient for is the journey that may cross silos of thought.
Right.
And so what I'd like to help myself understand, as well as everyone else, this journey has been about my understanding the language that can help explain this very complex disorder in a way that not only providers from different silos of thought can understand and embrace, but the patients can understand and embrace. Because when we're addressing a complex problem, we have to involve the patient in that understanding of complexity. And that's where the real rub is. Sharon said earlier, what do we do when they're too busy? There was a question that Sharon that's a difficult thing. People are too busy to handle this complexity, which is very frightening. And what do we do? The answer is that maybe we delight them, and maybe we give them we create a story that connects all of this complexity in a way that everyone can understand and embrace. And moving forward, we have a new language that centers this discussion on the patient's narrative and on their own personal needs. So that's really what I'm going to bring forward to this. And I've got 30 minutes to do it. And it's going to be a heck of a lot of fun, and I guarantee you that when we're in session, it's going to be a great time. So I can't wait.
And I can't wait just to have all the energies together under one roof. And it's so great because everybody, the attendees, we're all together, and there's just a synergy there that I really can't wait to do it all over again, March 15th and 16th at the Ritz-Carlton. I do want to tell a couple of courses that are coming up if anyone's interested. We are thrilled that Brittany Sierra's intro course is actually sold out for February, but the next course will begin on April 3rd. And she is affiliated now with the IAOM, so it will go towards certification to be a COM for anyone interested. We also have this course available on demand now. We try to get it so everyone has their different learning styles and schedules, so we can fit into your journey and help you become a myofunctional therapist and help these kids and adults who desperately need it. So we'll send you all the follow-up information. I'm not going to go ahead and read this here, but I also want to let you know there is shadowing, because I think that's a really valuable educational tool to have that one-on-one. I like to see do. That's my style, so it's great to shadow, and Brittany's offering that, so you can reach out to us and we're happy to put you in touch with her. And I'm thrilled that we're debuting our first sleep apnea screening course with Dr. Dave McCarty. It's our first MD to be on faculty. So Dr. McCarty, why don't you just tell us a little bit, because you explain it so much better than I do, with this full day of action-packed delight.
Yeah, so this is all about the language of the Empowered Sleep Apnea Project. So if anybody's interested, you can check it out on the interwebs at empoweredsleepapnea.com. But this is a cross-platform educational project that's designed to bring the complexity of this giant leviathan that we call sleep apnea into a language that everyone can share. Because when our patients are suddenly found outside, say a Western medical or a pioneering dental silo, they really don't know where to turn, and they don't know how to deconstruct this incredible vast language into something that means something to them. So this is based on my clinical experience in working across silos and working with education with individual patients to try and figure out what works. And part of this process is that when we collaborate with our patients with this complexity, and we can explain this vast landscape to them in a way that they feel like they've got agency, then we've got a new situation on our hands. Now we've got a collaborative effort that is a co-discovery process, to use the language of my new friend, Dr. Paul Henney. Co-discovery is what we're trying to do in this. And this full day course will give you the language to do that in a way that will prepare you and your patients to navigate this landscape in a way that feels right to all of us. So I'm looking forward to it, and it's going to be a great time.
We're excited having you the two on. It's so funny. I didn't plan this. It was kind of impromptu because I saw that you made references, but you have a wonderful podcast together, Empowered Sleep Apnea, where Sharon is your guest, and it's just the two of you, your communication style, and there's so much to learn. So we'll have that in the follow-up email also. And Sharon, can you tell us your contact information? I know you can either put it in the chat, but I will have it on the follow-up email. But people are asking how they can learn more from you and get in touch with you. You just want to share a little bit?
Oh, okay. Probably, how do I do this? I go to everyone.
Yeah, so you can do that, and then you just put that in the chat, and if you wanted to talk about it, while I just go ahead and see Dr. Susan Maples. There we go. Okay, projects at wellspoken.com.au. Please check out Sharon. As I said, you had so much knowledge tonight that we can all probably listen to that a couple of times to unpack everything that you have shared tonight. So I'm so glad you have a resource for everybody. We do have another new course coming up. We welcome Dr. Susan Maples to our faculty, and she has a course April 5th. And it's really, everything's about empowering and revolutionizing pediatric airway health. I love how she's going to go and do a hands-on children's learning lab. So she'll teach you how to do that, because you know that that's the best way. Sharon, you have 10 years of clinical child psychiatric experience, correct? So you know how important it is to have that hands-on learning to get the results you want, and the parents on board as well. So please join us April 5th. And our mini residency is kind of our entry level to become an airway dentist and be part of our alumni. So if you're interested as a doctor, dentist, pediatric dentist, orthodontist, and learning how to do interceptive orthodontics, these are technique courses. And we have a pathway that I'm happy to set up a call to discuss with you based on your needs. We range from older teens to young teens to fix under 6 with Dr. Kevin Boyd's mini residency, where he'll teach you his techniques that he's used for over 30 years. And the same thing with Dr. Brett Christensen is an orthodontist, so he'll teach you his techniques, actually over 30 years, they're about the same. And we also have an adult pathway as well. So we do have a couple of spots left for Friday. If you're interested in learning adult expansion with removable appliances and clear aligner therapy, you're more than welcome to join us. You can check that out on our website. And Dr. Gelb has his TMD to ortho. It's kind of a prequel to orthodontics, if you would, to get you ready to treat that acute TMD patient, to get them into ortho. If you want to download our flyers, there's the QR code, so you'll have a lot of information to look at, but we will send that up in the follow-up screening. I just want to make sure if there's any other questions here. Oh, Dr. McCarty, someone says you need to write a book for children now. So can you get busy on that?
Working on it. Actually,
Okay.
I've got some collaborative projects. I've been invited to be an illustrator on a children's story that's all about the importance of sleep. And so I've been delighted to sort of find what this journey has in store. And so, yes, if anybody out there has any other ideas, the future is bright.
Absolutely. Okay. And I just like to bring everyone's attention that I don't know if everyone's aware of this, but the ADA does have a brochure, and I find this very helpful when I was in clinical practice, I showed this to the parents, because it just seals the deal, if you would. It's not an office brochure. It has the ADA seal. I like to bring this to the pediatrician to start that conversation, to get their attention. That may be a good tool to use for that. So that's available on their website. And as you said, Sharon, we're both board members of the Children's Airway First Foundation, and they're doing amazing work there. And they have so many resources that a lot of people aren't aware of. So we encourage you to check them out and utilize them. They do a lot of work, really, so you don't have to. Sharon, you have a wonderful podcast with Rebecca on the Children's Airway First. Dr. McCarty, you have an amazing podcast. I think a part 2 is coming as well. So this is all geared towards parents and patients. We're speaking their language. So it's a great icebreaker for you. And perhaps it's actually a great way to train yourself how to have these conversations, because those were a lot of the questions that were asked this evening. We do have a conversation coming up. All of our conversations are free of charge, and we will provide CE, but we're encouraging everyone to invite parents and patients to this one. We're going to make this a little bit more patient friendly in conjunction with Children's Airway First. And we're talking about the early warning signs of sleep disorder breathing. So our last series with CAF, we talked about the origins of malocclusion and how we got here. And now we really want to bring attention to the warning signs. So like you said, not prevent, but intercept. Sharon, I heard that. I heard so many things you said today that I can't wait to take that to the next level. So please join us, and you can invite your patients for that one as well. We do have a free town hall for our alumni. It's just to ask the questions that they have after taking the technique courses, or a resource for all of our alumni. That'll be after that conversation on the 21st, I believe. Okay, so now we have our AHS raffle. We are actually doing a live ticket. I'm going to stop my share so everyone, there we go. I'm going to stop that share. We're going to do a live raffle to get a live ticket to Airway Palooza. So this is actually valued at almost $2,800. So we're excited for this one.
This needs a sound effect. There it goes.
Oh wait, we got sound effects. We got it. Hold on, the wheel. Thank you everyone for your patience. We have, who is it? Lee Edmonds. So congratulations. We hope to see you at the Palooza, and you get to meet all of these fabulous speakers. We'll be doing this for our next conversation to a live ticket. So please feel free to tell your friends and have you join us. So Dr. McCarty, thank you so much for joining us last minute. We just love your insights and the work you're doing. And Sharon, I am so grateful to everything you're doing and bringing the world a little bit closer. We are stronger together, and we can do this, and it's for the children. So thank you so much for everything, and we'll see you guys soon. Have a great evening.